Good day, everyone. I am Vince, the moderator of this webinar. I welcome everyone to today's webinar on HIPAA compliance in 2026, practical strategies for breach prevention, risk review, and audit-ready enforcement preparation. I want to introduce our presenter for today, Dr. Michael C. Redmond. Dr. Michael C. Redmond, PhD, MBA. She is a respected consultant and auditor with more than 15 years of experience in regulatory compliance and information protection. I would now like to hand over the floor to the speaker. Over to you, Dr. Redmond.
Thank you very much. I appreciate it. This topic is extremely important. So a little bit on my background more. I have been doing work for many healthcare organizations, as well as hospitals. I've worked with many pharmaceutical companies. So let's talk about what we'll be covering here. I'll let you read the agenda. I don't need to read to you anything that's here. These are some of the areas we'll be covering. Most important, we'll be discussing the audit red flags. I'm going to give you an introduction here very quickly, and then we'll go into depth on these. So we'll be talking about the cornerstones for protecting public health information, and it is very different this year. Much more on the protections of the patients, much more on the patients totally understanding what they're signing, privacy notice updates, new regulations, and I'll go through how to do these. But it's definitely transparency to be able to strengthen patient trust. Some of the new deadline requirements we've already passed. February 2025, you had the readiness plan and assigned accountability owners. In February 16th, there were deadlines to avoid heightened OCR audits, penalties, and reputational harm through on-time compliance. HIPAA compliance update, and an auditor will come in and say to people, when did you go through your awareness training? What awareness training? Advanced security technologies. So you want to protect civil rights. It works to safeguard across education, healthcare, and other public sectors for all individuals. HSS security rule, you have to safeguard electronic health data. Safeguarding electronic health data. You want to protect electronic health information using administrative, physical, and technical measures. Doing this to preserve your patient privacy. You're doing this to minimize risk, and you're doing this to support your cybersecurity best practices. This is why this is a must, not an optional. So incomplete documentation, if there's incomplete records, something even not initialed, it can signal non-compliance or improper reporting, often raise concerns, especially if I come in and do an audit as an internal auditor and I'm seeing that they're not dated. It could also be physical records. We're not looking only at electronic under this. We're also looking at your physical records. 15 days is the new maximum response time to fulfill patient access requests under the 2026 privacy. That is fast. So the updates are updated patient rights. You have to revise your NPPs to reflect current rights, including new ways patients can access public health information, how requests are handled. So you want to know your compliance strengths. Transparent and accessible notices foster patient trust and reduce audit risk. The entities with up-to-date notice are likely to trace enforcement actions. So you want to make sure you want to be able to do closing gaps, review your policies and procedures. Make sure you're reviewing all of your audit logs. Prompt incident response and comprehensive staff training to prevent repeat findings. So security rule updates, you want stronger encryption standards. You want to have mandatory multi-factor authentication and expanded risk analysis scope. Your risk assessments, you want to make sure you're using probability. So incident response life cycle, you detect it, you contain it, you notify the external stakeholders immediately, within the time period. You eradicate the problem. The systems are now restored to normal application, and there's post-incident review. But you want to look at your operations. What are the strengths? Are there robust policies and periodic audits? So monetary penalties. Recent OCR settlements includes fines from 100 to over 5 million. So your compliance roadmap, you have gap analysis, the review, stakeholder engagement, staff, very, very bad thing to do. Staff training impact, e-learning. There's lots of e-learning practices you can use for training. Live sessions, you can have someone come in, such as this. You can do webinars. Webinars are perfectly acceptable throughout the organization. So the NIST aligned risk cadence. So you can have, you want to have, and again, this is more technology aspects, but absolutely 24/7 monitoring. So some of the common breach causes are high profile incidents, repeating, tracing back to phishing. So you need to know for your audit response plan, what are your roles and responsibilities? So you want to run simulations for the audit. You want to run mock reviews to show that, yes, they're fully believe in the risk assessments, etc. I want to see in their documentation from the senior leadership. The regulatory forecast for 2027 are expanded patient data access rights, yet again, even stronger across clinical and consumer health data. To be built for change, guided by insight. You need to have some of the questions you're going to want to ask. Policy update checklist, do this now. You want to look for your education support, stay up to date. You want to stay positive and proactive. Don't fall behind. Strengthen security, definitely your physical security and your cybersecurity and incident response. Train continuously. So be audit ready, use continuous risk assessments, breach prevention practices. And with that, we are totally on time. Thank you. I want to thank you for being on this call today. Thank you very much for being here, and I look forward to seeing you on the next webinar.
Thank you, Dr. Edmond. That concludes the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead.
Thank you. Bye-bye.